Hello, everyone. Welcome back to St. Louis Teens. We are here today with another podcast with Dr. Zinser, who is the head of Infectious Disease at SSM Health. And he has also previously helped us understand the current coronavirus pandemic and what we can do. As all of us continue to battle this pandemic, there are several unknowns about this virus, which has become a recipe for several myths. And we are hoping to be better informed from our experts in the field. So, Dr. Zinser, before we get started, on behalf of St. Louis Teens, we thank you for being on the front lines and saving the lives of many. You're our hero. And I just did want to ask, how has it been, being on the front lines of this entire epidemic?
Uh, from my perspective, it's been really interesting because we approach it from so many different directions, both scientifically and administratively, and just the mechanics of how the hospital works. The people who I most admire are the nurses and respiratory therapists and intensive care physicians who have the most direct contact with the patients.
Wow. Well, I sort of moving into talking about the virus itself, being a teenager and now being home all day, I think there are a lot of us who are sort of reverting to online sources for information. And, we have noticed that there are, numerous topics that are worthy of discussion and clarification from experts, like yourself. So the first thing that has been seen a lot, and maybe a myth or may not, is kids and youth are immune to COVID-19. So is this true, and if it is, to what extent is it true?
It's not true. Young people, including even children, have died from it. One of the first cases that was seen out in St. Charles County was a 19-year-old who had a very serious course.
Yeah. So I think that by now the cases are not zero, but can you shed some light on exactly, what percent of kids and youth both infected with symptoms and the number of fatalities, or maybe about an estimate if that's possible?
I don't have accurate numbers on that,
Okay.
but it is less than 10%.
Okay. So the second thing that has been, seen a lot is that the use of antibacterial soap over plain soap is necessary to kill, the coronavirus if it were to sort of be on your hands or your body.
That's not actually true. The purpose of soap is actually to make water the atoms of water be able to move around in a more slippery fashion with each other, and that is how soap works. It makes the water be able to remove things more easily.
Okay.
A disinfectant is a product that kills bacteria or viruses, and soap is something different. Antibacterial soap, the way what makes it antibacterial is it has a high pH.
Okay.
That high pH is hard on bacteria, but it's also hard on your skin. And one of our best protections is healthy, intact skin. So antibacterial soap is not really a priority over regular soap.
I think that, another thing that has sort of been talked about, and this has actually been, put out by the CDC recommendations for everyone to wear at least a homemade mask. However, then the president sort of indicating that it's optional. Where do we lie on the fact that cloth masks, to some extent, are needed by everyone whenever they go outside?
Well, that's the current recommendation, and of course, the recommendations change constantly as they adjust to the situation. With the current situation, the density of infection in the population, or the density of the infected population, is higher than it was previously. And so there are more people walking around with the virus who don't have a diagnosis than was previous. And so the idea of ameliorating that in some fashion by having some control over the dissemination of the virus in the air around you is the goal. The mask slows down the speed with which water droplets leave your mouth, whether you're just speaking or if you're coughing or sneezing. And so that has some protective effect to people around you. Again, the purpose of the masks is to protect people around you, not really yourself.
Okay.
And unless they are N95 medical grade masks that are used for a different specific situation where that virus is being aerosolized by medical procedures.
So another sort of, topic that has popped up a lot on social media and is one of the, more extreme ones on this list is, blowing a hairdryer into the nose and throat, and the steam inhalation to kill the virus in the nose and throat as possible. So, how much of this is true, if any part of it is true? Is the heat killing the virus true to that extent, maybe?
No, it's not true at all. If the temperature inside your nasal passages and your throat were high enough to kill the virus, you would be doing extreme damage to your tissues. What you would get with a hairdryer is not going to make any difference.
Another, sort of more reasonable one at least is that drinking hot water, every 15 minutes, a bit over room temperature, could be helpful. So, so the two questions here are, one, is hot water, helpful? And then the second is, what should the frequency be, perhaps?
Hot water is not helpful. It doesn't. So when the virus causes infection, it's inside your body, it's in your bloodstream, it's inside your lungs, it's inside membranes in your nose and other places. Drinking hot water isn't going to have any effect on that.
And then the last one is that, parcels from China carry the coronavirus. To what extent would this even be true? And then do you have sort of any recommendations on how, parcels or shipments need to be handled properly?
The time it takes to transport a parcel from China, even if it had a heavy contamination on the outside, which parcels aren't likely to have to begin with, by the time it got to the United States and got distributed, none of that virus would be viable at all.
Okay. Well, so that's all the sort of myths that, we have come across, or sort of the interesting, possibilities for myths. So have you come across any other compelling myths that you would like to share with us?
Nothing comes to mind.
Okay.
well, there are all kinds of things that pop up on the internet about
Yeah.
treatment and uh, uh, infectivity. Uh, none, if the treatments that we use, none of them have been tested in a double-blind study
Okay.
with any validity, and they've been selected out because of really anecdotal information. We do think some of them work, but we're just learning about them. The things that haven't been used on a broader scale have even less validity to them.
All right. Well, thank you so much, Dr. Zinser, for your time and advice. Equipped with your answers, we wish to continue to keep all of us safe and fight this pandemic, in an efficient manner and in the correct manner. So thank you.
Thank you very much.